Mental health care can often come down to one question. Can people access it? Can they get to it? In Metro Atlanta, there is a new initiative trying to answer that by removing some of the most basic barriers for low income and underserved patients. The work's being done by Sostento. Here to walk us through how this model works, founder and CEO Joe Agoada. Thanks for the time, Joe. Mental Health Awareness Month right now, but this is always an important conversation. Talk about the work being done to bring down some of those barriers.
Yeah, thank you for having me today, Cheryl. This is a really important issue. According to data from Mental Health America and the U.S. Census Bureau, Georgia faces a severe mental health crisis. They rank 47th nationally in access, and 34% of adults cite barriers to reaching mental behavioral health care in the state. I believe there's no doubt that that is because Georgia also ranks among the top of uninsured individuals in the country. Roughly 12% to 13% in Georgia lack health insurance, and that's way above the national average. And that tallies up to 1.2 million Georgians who, under the age of 65, are living completely without health insurance. And when you're uninsured, your ability to access not only primary care, but mental and behavioral health care can be incredibly difficult. Even getting transportation to reach charitable care services that might be available for you can really disrupt your continuum of care. And getting through the maze of paperwork and qualifications can be incredibly difficult. I think we all know, even if you have health insurance, it's a challenge. And that's the work that Sostento is doing, the nonprofit I lead. We are focused on removing barriers to care for uninsured individuals nationally. We've been doing this since 2019, and Atlanta has been a big area where we've been doing this work. We have been partnering with free and charitable clinics, community clinics across the metro area to help remove barriers to mental behavioral health care. And we've been doing that with the support of the Anthem Blue Cross Blue Shield Foundation of Georgia and the Syncora Impact Foundation. As well, Uber is our partner, so I'll look forward to talking about what they're doing with us. But I'm here to just share these stories of impact so that your audience can know what's going on and the good work that's happening in Atlanta, increased access, and how they can help.
I'm sure people are listening to you, nodding their heads, understanding, as you pointed out, even if you have insurance, it can be a real challenge, a real fight to try to get in, to have access, and to find out there is perhaps a lot of cost associated with the treatment you need and are trying to access, even if you have insurance, but especially if you don't. Talk about this partnership. You talked about the community clinics. You talked about Uber. What's the core issue this initiative is really trying to solve right now in Atlanta when it comes to accessing mental health care?
So we're looking to remove the barriers, and that starts with making sure a patient never misses or doesn't make it to an appointment because they don't have transportation. A lot of people don't understand that when you're a working professional, when you have a job 9 to 5, it can be very hard to get to your local clinic during open hours. Even if, let's say, there is a bus route, there is, maybe you can try to get a ride for a friend. If you don't have a car, simply getting to your appointment can be incredibly difficult. And so one of the things that we're doing in Atlanta is we are offering free Uber rides for individuals to get to these charitable care providers. We've been doing it for the past 2 years, and I'm happy to say we've delivered over 11,000 rides across the Atlanta metro area, 2,600 unique riders, and the patients paid $0 for these rides. And what's really interesting as well is that they don't need to even open up an Uber app. They don't have to do anything. The Uber ride is ordered by the charitable care provider. Combined, these rides have traveled over 130,000 miles. That's halfway to the moon. And it is really sometimes overlooked how simply getting transportation can make sure you don't miss, or maybe you make that appointment you should have. So one just story, I was recently visiting the Healing Bridge Clinic. This is in Peachtree City, and I met a patient named Dale. Dale is in her late 50s. She lacks health insurance. She has mobility issues. She has a cane. And she described to me that before she was unable to make appointments to get to the clinic, even for primary care, let alone the behavioral and mental health care needs she needed, because she had to rely on her son for a ride. And her son works 9 to 5, and he couldn't always take her when the clinic was open or when the clinic had an appointment. But thanks to these Sostento rides that we're providing, the clinic literally knows when her appointment is. She doesn't have to do anything. She gets a text message that her ride is there. It picks her up. It brings her into the clinic. And not only is she wanting to use these rides to get to the clinic, but we know for mental behavioral health needs, it's about making sure, do you have fresh groceries? Can you get the specialty care you need? So she's using these rides not just to get to the charitable clinic, but also to get to some other of these needs that she has.
That's a great story. One story of 2,600 riders. As you mentioned, you talk about 11,000 rides. That makes a big impact. So now that you've been doing this for a while, how are you seeing this access and these rides impacting outcomes?
Mm-hmm. So we went on a learning journey after we removed the transportation barrier to care. So someone can make an appointment and make it there on time. We started talking to the providers and saying, what is getting in the way of someone maybe getting behavioral and mental health care? Number one, we learned we need to ensure primary care providers are trained to have these conversations. So we learned that it's easy when someone comes in with a cough, a rash, a broken arm, you can see it. But someone could be suffering silently and quietly with their mental and behavioral health issues. So one of the things that Sostento did was train the clinics in our initiative to make sure they could have these conversations with their patients. We also learned that the providers were hesitant to have the conversations if they didn't know where they could send someone for mental and behavioral health needs. So what we did was we built local relationships for the clinics so that they knew that when I talk to someone, I screen them, I assess them, and I find out that they have needs, okay, I'm going to be able to send them somewhere. And so once we kind of built these mechanisms in over the since last summer, we've been saying, hey, anyone who comes in a Sostento ride into your clinic, you're going to have a conversation with them about their mental behavioral health needs, and you're going to try to screen them. And in the last, about year and a half since last summer, we've done 10,000 screenings. We've also seen 2,500 individuals referred to follow-up resources and connected to care. And oftentimes they use one of those rides after their screening process to get to care. And I just want to share one story about one of these individuals that came in on a ride, was able to be screened and got care. And this is at a clinic called Ethne Health. It's in Clarkston, just outside of Atlanta. And they had an expectant mother come in, and she was under severe mental health distress. And what they found out was that she had lost her insurance because of a administrative paperwork issue, and she couldn't figure out what was wrong. She couldn't get back onto her insurance. And so through the screening, they were able to understand, okay, she's facing severe mental duress, and the reason behind it is because she had her insurance dropped. And the clinic was able to use the rides as well as helping sit with her and get her through the phone trees to figure out what was wrong, get her back onto her health insurance. And so, use the rides to get to the clinic, but ultimately also use rides to the administrative office to get that paperwork done, get her back on her insurance so that she could have her needs taken care of. So again, you can see sometimes, it's not just about connecting someone to maybe a therapist or a psychologist, but sometimes it's also about connecting them to other needs that they may have, whether it be for some kind of, gaining access to a public benefit or fresh groceries, the gym, job interviews. These are all things that we've seen our rides be used for to help address someone's mental and behavioral health needs.
As you were telling that story, I immediately went to the maternal health crisis that's happening in Georgia, and a ride like that can really change an outcome. And so I can see why it's important in so many ways. Really quickly, before we let you go, what are the plans to potentially expand?
Well, again, we're kind of coming to the end of our pilot project here in Atlanta, where we've worked with 5 different free and charitable clinics with the support Anthem Blue Cross Blue Shield Foundation and Sequoia Impact Foundation. And we actually ran a similar pilot in Chicago. So we've just are completing our Atlanta and Chicago pilots. And what we're going to determine is how can we spread this across Georgia, as well as across Atlanta and the country. So we've really been inspired by the hard work of the health workers in Atlanta, what they've taught us about this approach, how they've helped us strengthen it. And really the future is about how can we sustain it, how can we make it replicable, and how can this become a model for many of the other states that we're working in across the country.
All right, Joe Agoada with Sostento, the founder and CEO. Really a conversation from state leaders down to kitchen tables that is so important, getting access to all kinds of health care. Really appreciate you filling us in on all these new efforts to try to get people where they need to go to make sure they can access it.
And lastly, if someone's looking for care, there is a website, gacharitycare.org. That is a place where you go if you're uninsured, if you're trying to say I could really benefit from this. There is a state organization called the Georgia Charitable Care Network. They have a whole list of these clinics that offer care free of cost to individuals living below the poverty without health insurance. And again, you can go to gacharitycare.org to learn about that. And you can go to sostento.org if you'd like to support our work.
All right, gacharitycare.org. Joe, thank you so much, and keep up the great work. We'll look forward to hear about the progress in the coming months.
Thanks for having me, Cheryl. Have a good one.
You bet.